I have to say I cannot skip fair. Now that we talked about the F of fair, you just discussed the I of fair. I feel like we have to discuss FAIR principles and the data sharing standards in the context of health data research infrastructure. So what's happening there? What's the status?
So the interoperability, what the question is also about, is one of the most difficult aspects.
Sorry, first of all, maybe if somebody in the audience doesn't know, why don't we actually define what FAIR means?
Okay. The acronym stands for Findable, Accessible, Interoperable, Reusable Data. There are actually 15 principles who are underlying FAIR, and they were published in a Nature Scientific Data article in 2016. So you can look that up. It's called FAIR Data Guiding Principles.
So it's really recent. It's really new. It's not only 2016, so it's about 1.5 years ago.
Yeah, the term is new. The concepts are a long time around. But I think if you apply them to health data, then one of the problems that we have is indeed having good interoperability standards and metadata coverage. There is a lot already there. So if you take the OMOP data model, for instance, that we work with and the Odyssey tools, you can see that they're standardized on ontology choices for all important types of data. So you have an ontology to use for diagnosis, which is SNOMED CT. You have one for lab measurements, which is LOINC. You have one for drugs, which is RIGNORM. You have one for procedures, or multiple, because procedures is harder to standardize. It's more tied in with the hospitals and the health system in the country, or even locally. So we have a lot of standards, but they're standards from a research point of view. And as I just explained with the lab measurements, there's also the operational hospital point of view, which is where most of the money is, right? So maybe a very fortunate university medical center, like the UMCU, say, here in Utrecht, they might have half money for the clinic and research. But by far, most of the hospitals, their main concern is simply treating patients and having the trains running on time, or indeed in a hospital context, serving your patient 24/7. That's the key. And research is more of a nice thing to also do, but it's not what they are held accountable for, and maybe for good reasons, right? But in this case, when you're trying to make use of this health data, which comes out of the operational context for research purposes, that's where you actually run into trouble because of this bridge.